Welcome to Sex Ed with DB. I'm your host, DB. Let's get into it. Black Friday deals are here, and it's time to invest in something that gives you the pleasure you deserve. As a sex educator, I look for body-safe materials, smart design, and toys people actually keep reaching for. For over 20 years, Lelo has been redefining luxury pleasure, making toys that are so beautifully designed, they belong on your nightstand and your vision board. The Sona 3 Cruise is one of their icons, and it's designed for the kind of deep, all-encompassing pleasure that you want, and gives you the smoothest path to a fuller, deeper, and more intense orgasm. Go to lelo.com for their amazing Black Friday deals all month long, and use my stackable code SEXEDWITHDB for an additional 15% off. Let me tell you about the most fun homework assignment I have ever given: daily magic wand time. It started with me doing a 21-day experiment to answer one question. What happens to stress, sleep, mood, and sexual satisfaction when I use the magic wand every day versus when I have partnered sex versus when I have no sexual activity at all? The results were honestly so fascinating that we turned it into a full-blown scientific study with over 1,000 participants. Now we have real data on how consistent solo pleasure can impact mental health and overall wellness, not just orgasms. Curious? Go to magicwandstudy.com and read what we found.
I'm Saharzad. As a journalist traveling the world, I've covered all sorts. Think war zones, scandals in Tokyo, and have sat down with the Taliban in Kabul. But this podcast isn't about any of that. It's about sex. We'll meet people whose lives, work, and identities sit at the more unexpected edges of sex.
I tap into the vulnerabilities of others and I mold them into a bubbling desire.
From Vespucci, this is Doing Sex.
Let's talk about the MVP of my nightstand, Lube. It's silky, long-lasting, and makes sex smoother for literally everyone involved. Solo, partnered, situationship, whatever. It reduces friction, boosts pleasure, and it's condom-friendly, scent-free, and not sticky. I love a lube that's recommended by leading doctors and gentle on sensitive skin. Want to upgrade your lube? Use code SEXEDWITHDB for 10% off at uberlube.com. Treat yourself to some Uberlube. Hey, DB here, your favorite sex educator and pleasure expert. I am really excited about our question today, which is it normal to always feel sore after sex? And we'll get into that in a second, but last week we had Dr. Shamika Thorpe on to talk about Black women's pleasure. And while we were discussing that and her research, Dr. Shamika brought up pain. And I asked her at the end of the interview, like, if you had unlimited resources, where would you want to go in this field? And she mentioned that she would create a holistic center that dealt with pain for pelvic floor PT, pain management, pleasure education, and more. And, I learned that we honestly can't talk about pleasure without talking about pain for some people. It is linked, it is connected. And if you didn't listen to that episode, pause this one, go back now before diving into this one, because it's so, so good. But now on to today's topic of, is it normal to always feel sore after sex? If you're someone who's taking inventory of your body and mind after sex, and you find that you have constant vulvar pain, you are not alone. Pain with sex has a name. It's called dyspareunia, and it is common. Population studies from the American Academy of Family Physicians estimate roughly 10 to 20% of US women report sexual pain at any given time, and the rates are even higher after menopause, unless we treat dryness. That's not something that we should accept as just how it is, but it's a cue to actually see what is going on behind the scenes. Now, what counts as normal soreness? Occasional tenderness after longer or more vigorous sex, new positions, less sleep, lots of friction, or just not enough lube. But usually it might settle within a few hours to 24 hours. So think of it kind of like muscle fatigue. Like if you work out and then you're kind of sore, and then usually after like a few hours or after the next day, you're not as sore. But what's not normal is soreness every single time. Pain with insertion, deep pelvic pain, burning at the entrance, pain that lasts beyond a day, bleeding, fever, foul discharge, or pain that's making you avoid intimacy. Those are red flags to get evaluated, according to the Mayo Clinic. Now, I also just want to name a disclaimer that this episode is mostly for people with vulvas, no matter your gender identity. So take that what you will. If you're someone with a penis and you're interested in learning more, write in to me at sexedwithdb@gmail.com and we'll do a separate episode about that. Moving on, here's an overview of why sex can hurt. There are lots of different reasons, and we'll go bit by bit. So the first one is that there might be friction and or lubrication issues. So if the tissues are dry and your lube game just like isn't what it should be, you're not using it enough, friction can really skyrocket and tissue can get micro irritated and it could tear. Menopause, postpartum, breastfeeding, and some meds, depending on what they are, decrease estrogen and natural lubrication, which can lead to dryness. So a solution is adding lube liberally. Say that 10 times fast. And choose the right kind for you. There's water and silicone-based lubes that are condom compatible. Oil-based lubes damage latex, so only use oil-based lube if you're not using condoms. But silicone does last longer. But water-based lubes can be used with sex toys. So really kind of choose your main character. And if you're navigating menopause, vaginal moisturizers and for many, low-dose vaginal estrogen are evidence-based effective options, according to the Cleveland Clinic. Tiny little myth-busting moment. Antihistamines and other medications with drying effects can indeed contribute to vaginal dryness. So if that sounds like you, just ask your clinician about swapping out that med or another strategy. Another reason why sex can hurt is pelvic floor muscle overactivity. So if your pelvic floor muscles are clenched from stress or are guarded after painful attempts, or it's just a habit, penetration can feel like pushing into a wall. It can feel really painful. So afterwards, you feel sore, achy, crampy. And the DSM-5 now groups this under genitopelvic pain / penetration disorder, GPPD. And specifically when it's persistent and distressing. But the good news is that pelvic floor physical therapy shows meaningful improvements in randomized trials. So something to look into if you haven't tried that. There's also vulvar skin and nerve pain. So provoked vestibulodynia, which is pain at the vaginal entrance when touched, and other forms of vulvodynia can make even light contact feel like burning. And this is common, it's real, and it's treatable with a combination of different approaches. So we have already talked about pelvic floor PT. There's also gentle skincare. There are meds, again, using lube. And something to be aware of is that allergies or irritants can also inflame tissue. So latex condoms, you might be sensitive or allergic, and they have certain additives that could make your skin just feel bad. So if you notice burning or itching after condoms or like flavored or tingling products, just try latex-free options and unscented lube. Patch testing on a different part of your body can also confirm a contact allergy, so you could try that. Another reason why sex could hurt is because of hormones and or life stage that you might be in. So low estrogen states, aka during menopause or postpartum or breastfeeding, certain cancer therapies, thin and dry the tissue. And that's now called genitourinary syndrome of menopause, GSM. Vaginal estrogen or DHEA and regular moisturizers can reduce dyspareunia and improve tissue health. And some combined hormonal contraceptives are also associated in some people with dryness or vestibulodynia. If you suspect some sort of link with your hormones or your life stage and your pain, talk to your clinician about what you can do about that. Next, we have infections and inflammation. So things like yeast, BV, UTIs, and STIs like chlamydia or gonorrhea can all show up as pain with sex or soreness after. Deep, achy pain with fever or unusual discharge or bleeding or new pelvic pain could be pelvic inflammatory disease, according to the Mayo Clinic and the Cleveland Clinic, and really needs prompt care. So don't guess or don't brush it off. You should get tested and treated. Now is just a perfect time to plug that like STIs are on the rise. We should be, especially if we have multiple partners, be getting tested before and after every single new partner. So yeah, it's really, really important to look out for deep, achy pain, fever, unusual discharge, or new pelvic pain, and get tested for STIs. Also, it's worth noting that sex itself is a strong risk factor for UTIs in many people with vulvas. So if you get UTIs often after sex, there are clinician-endorsed prevention options from the American Academy of Family Physicians. And yeah, so just definitely like take that. If you know that about yourself, make sure that you are trying to prevent your UTI and or that you have proper remedies for afterwards. All right. Last reason as to why you might have pain during sex is pelvic conditions. So endometriosis can cause sharp or deep pain with certain positions, sometimes with bleeding or long-lasting soreness after. Interstitial cystitis or bladder pain syndrome, fibroids, ovarian cysts, and IUD malposition can also contribute. So if your pain is deep, cyclical, or it's position dependent, really flag that pattern for your clinician. Speaking of what you should do for your clinician, it's important to make like a mini map or a list to describe your pain so that you can get the proper care that you need. And so a few questions to ask yourself if you are someone who experiences pain during or after sex. Where do you feel it? Is it at the entrance or deep inside? Is it a burning or stinging or an ache or a sharp pain? When does it happen? With penetration, with deep penetration, with thrusting, with initial entry, after orgasm? How long does it last? Is it minutes? Is it hours? Is it days? What helps or worsens it? Does lube help, but different positions worsen it? Do you need a longer time to get aroused? And are there any red flags that are clear that you want to share with your provider? Fever, foul discharge, bleeding after sex, or pain that's severe enough to stop you? So here's the good news. Here are things that you can try that are low risk and evidence-based. So arousal first, entry second. More foreplay, more foreplay, more foreplay. Foreplay is sex. I don't know how many times I got to say it on this podcast, but I'll keep going. Kissing, touching, licking, that is all sex. People with vulvas on average need or desire, like roughly 20 minutes of foreplay before intercourse in order to be like wet enough and have enough lubrication. And a slower runway really increases that blood flow and increases that natural lubrication from your body. Less friction leads to less soreness. Next, upgrade your lube and use a lot of it. Reapply. Water or silicone-based lubes with latex condoms, and skip the oils with latex. And if you use silicone toys, make sure you use a water-based lube. Moisturize between sessions. So if dryness is an issue, think of it like a face moisturizer, but it's actually for your vulva and your vagina. So in menopause or postpartum, talk to your clinician about vaginal estrogen. It's a small local dose and often really changes comfort level for a lot of people. Experiment with different positions. So if deep pain shows up with certain angles, like doggy style, don't do it. Try a shallower penetration. Use your hands to control depth or switch positions that reduce pressure on the cervix or tender areas. Pelvic floor down training. So diaphragmatic breathing, longer exhales, and gentle bulging or relaxation cues can help muscles let go. And pelvic floor physical therapy is highly effective for persistent pain. So check that out. Check your products. Make sure you're avoiding any fragranced washes. Don't use tampons that are scented, anything that's tingling or warming, no numbing creams, nothing. Make sure that you pay attention if you're using condoms. If you have a latex allergy, switch it and try something new. And make sure you're keeping like a symptom journal of like if and when you use a product, what happens. And finally, make sure you are getting tested, screen for infections. Any new discharge or odor or itching, urinary burning, or pelvic pain, get it tested and treated, and the sooner the better. Okay, when should you seek care? So obviously, this is not medical advice. This is a podcast, and I have a master's of public health. I am not a doctor. So it's really important that you figure out your own experiences and think about these things when you're thinking about when to seek care. If you have pain or soreness every time, pain that lasts over 24 hours, bleeding, fever, foul discharge, or pain that's escalating, see a provider. If you suspect endometriosis, vestibulodynia, pelvic floor dysfunction, or allergy, you should see a provider. If you are in menopause or postpartum and dryness is making sex consistently uncomfortable, there are treatments that you can chat with your provider about. So here are your takeaways that I will leave you with at the end of this episode. Occasional mild soreness that fades quickly can be normal. Always sore is a solvable problem and is not normal, and you should check with a provider about you always being sore. But you can also start with more arousal, more lube, less friction, taking your time, checking products, and considering pelvic floor PT. If red flags pop up or it's persistent, please see a clinician for tailored care, especially to rule out infections, pelvic floor issues, or endometriosis. And just remember, your body is not too sensitive. You do not have to grit your teeth through sex. Pleasure is supposed to feel pleasurable. Let's, normalize by asking for gentler pacing, wetter sex, and expert help when we need it. And if this episode brought up something for you that feels challenging, know that you're not alone. I will link some of these resources in the show notes. And as always, hit me up at sexedwithdb@gmail.com. If you want to share your experience or your story, if this episode helped you. You deserve comfortable, enthusiastic, yes, please, painless sex. Love y'all. Talk to you next week.